The amniotic fluid volume is regulated by the balance between the production of fetal urine. So again, if you'll try to remember, fetal urine is the major contributor of amniotic fluid volume, as well as the presence of lung fluid and lung surfactants. So aside from that, the volume is also associated with absorption from fetal swallowing and intramembranous flow. So intramembranous flow is the absorption of amniotic fluid by the fetal vascular system. So the normal volume of amniotic fluid again at third trimester ranges at 800 to 1,200 milliliter. So volume greater than that or greater than 1,200 milliliter is called polyhydramnios. So polyhydramnios is usually caused by failure of fetal swallowing. So what are the conditions associated with failure of fetal swallowing? So conditions associated with fetal distress such as neural tube defects. So for oligohydramnios or decreased amniotic fluid volume less than 800 milliliter, associated naman with increased fetal swallowing, urinary tract deformities, and membrane leakage. So what are the indications or reasons for performing amniocentesis? So it is performed usually at 14th week gestation because at this stage, safe procedure na siya to perform. So, at second trimester, usually kapag you're trying to perform amniocentesis at second trimester, you're trying to detect chromosomal or cytogenetic abnormalities. So, for third trimester amniocentesis, you're trying to assess naman fetal lung maturity, as well as fetal distress or yung mga neural tube disorders natin, as well as conditions associated with hemolytic disease of the newborn. So, second trimester again, associated 15 to 18 weeks gestation. Third trimester, 20 to 42 weeks, or some books says 30 to 42 weeks gestation. So here's a picture for indications for amniocentesis. So hindi ko na siya isa-isahin, but I just want to reiterate that amniocentesis performed at second trimester is usually used to detect chromosomal or cytogenetic abnormalities. So kung makikita nyo dito, puro siya chromosome abnormalities, mga genetic abnormalities. So again, birth defect, again, metabolic disorder, which are all associated with abnormalities at the chromosome. So again, genetic diseases. Okay, so for amniocentesis, performed naman at third trimester or 20 to 42 weeks gestation, usually used to assess for fetal lung maturity, fetal distress, so associated with HTN. Okay, so next, we have yung collection. So collection again is performed by means of amniocentesis. So the most frequently performed procedure for amniocentesis is the transabdominal amniocentesis. So vaginal amniocentesis is not usually done because it is more dangerous procedure as compared with transabdominal. So the maximum amount of fluid collected is 30 milliliter, which is then transferred to a sterile plastic container. So take note, fluid for OD450 analysis must be protected from light at all times. So why is that the fluid for OD450 analysis must be protected from light? Because OD450 analysis refers to the testing of bilirubin in the amniocentesis, rather in the amniotic fluid. So the chemical composition of amniotic fluid. So placenta is the ultimate source of amniotic fluid water and solutes. So the composition of amniotic fluid is similar to that of maternal plasma. And so again, at the first trimester, majority of the volume is derived from maternal circulation. That's why they have a similar composition. So aside from that, it contains small amount of slough fetal cells from the skin, digestive system, and urinary tract. Uh, Amniotic fluid arises from the fetal respiratory tract. That's why may present ng mga lung surfactants. Again, fetal urine, amniotic membrane, and umbilical cord. So again, kung maaalala nyo before na the major contributor of amniotic fluid volume is fetal urine. Okay, that's why chemical or mga substances such as creatinine and urea can also be detected in amniotic fluid. Okay, so that's why ito pa nga, si creatinine can be used to assess the fetal age because again, after trimester, dun pala nagiging major contributor ng volume yung fetal urine. So creatinine is used as an estimation of fetal age. So why is there a need for us to differentiate the maternal urine from amniotic fluid? Because it is necessary because in cases of premature membrane rupture or premature labor ni mommy or there is an accidental puncture of the maternal bladder. So imbis na yung amniotic membrane or amniotic sac yung na-puncture ni physician, na-puncture niya pala yung maternal bladder. So how will you differentiate maternal urine and amniotic fluid? So usually can be differentiated by two ways. So it can either be differentiated by means of a chemical analysis or the Fern test. So for chemical analysis, you need to assess the levels of these four chemicals, is urea, creatinine, protein, and glucose. So, how about for Fern test? So, si Fern test naman, usually done at amniotic fluid. So, it is used to evaluate premature rupture of the membrane. So, for urea, creatinine, glucose, and protein, so again, it is used for it is the chemical test used for differentiation of amniotic and maternal. So, si urea and creatinine, of course, ang magiging positive dyan or mas increased siya with maternal urine. Although, meron din, again, nasabi ko naman kanina na may present din ng urea and creatinine sa amniotic fluid, but take note na mas mababa yung level niya or concentration as compared with maternal urine. That's why, uh, among the four chemicals, the most reliable test to differentiate the amniotic fluid and urine is the urea and creatinine. Okay, for glucose and protein, it is less reliable, although it says here that mainly the amniotic fluid is positive, but there are also conditions that may cause the maternal urine to become positive for glucose and protein. Okay, usually kasi in once na pregnancy mother, usually nagpa-positive din siya sa glucose and protein. So may mga conditions 'yon, 'di ba? For example, gestational diabetes or in cases of preeclampsia. Okay, so 'yon, pwedeng mag-positive sa glucose and protein yung maternal urine. So next we have the Fern test. So again, Fern test is used to evaluate the premature leakage of the amniotic membrane. So for Fern test, a vaginal fluid specimen, so yung fluid na lumabas kay mother, is spread on a glass slide and allowed to completely air dry at room temp. So wala namang i-add dito na reagent or chemical. So gagawin mo lang, kukuhain mo na yung specimen, air dry, and then observe microscopically. So the positive result here is the presence of fern-like crystals, which indicates the presence of amniotic fluid. So kapag nakita ka ng fern-like crystals, ibig sabihin yung fluid na tinest mo is amniotic fluid. So now we move on to specimen handling and processing. So fetal lung maturity test. So ang handling dapat dyan is that all tests for fetal lung maturity must be placed in ice for delivery and kept refrigerated. So lahat ng mababanggit na test under fetal lung maturity, ang special handling procedure nun is that placed in ice as well as refrigerated yung dapat yung specimen. For bilirubin testing or OD450 analysis, dapat protected from light. For cytogenetic or microbial studies, so of course, processed aseptically to limit contamination and must be maintained at room temperature or body temperature in cases of 37 degrees incubation. So all fluids for chemical testing should be separated from cellular elements or debris as soon as possible to prevent disintegration or alterations on the chemicals because of cellular metabolism. So what is the normal appearance of amniotic fluid? So it is usually colorless with slight to moderate turbidity. So the turbidity is attributed to the presence of normal cells or sloughed fetal cells. So those that I've mentioned earlier. So for blood streak, so again, blood streak, amniotic fluid in cases of traumatic tap or trauma or intra-amniotic hemorrhage. So for yellow, again, presence of bilirubin. So dark green, so ulit yung alam na alam natin, dark green mucoid, meconium, or yung first fetal bowel movement. So very dark red-brown or red-brown is considered as an indicator of fetal death. So now we have to discuss tests for fetal distress. So under tests for fetal distress, we're trying to assess if there is a hemolytic disease of the newborn or neural tube defect. So hemolytic disease, under hemolytic disease of the newborn, so the oldest routinely performed laboratory test to assess the presence of hemolytic disease of the newborn is to assess the severity of the fetal anemia. Okay, so we're trying to detect here the severity or presence of fetal anemia. So how will you assess fetal anemia? So by determining the extent of hemolysis. So how will you assess the extent of hemolysis? By subjecting the specimen through spectrophotometric determinations. Okay, so what will you measure spectrophotometrically? So the presence of unconjugated bilirubin. Okay, so dito na papasok yung nabanggit natin kanina na OD450. So determination of unconjugated bilirubin in the amniotic fluid. So here is OD delta 450 or OD450. Okay, so how it is done? How is it done? OD450. So in the normal fluid or in the normal amniotic fluid, the optical density, so OD optical density is same as absorbance. Okay, same lang sila. So yung absorbance ng normal amniotic fluid is highest at 365 nanometer. So yung normal absorbance dapat ng amniotic fluid is 365. But when bilirubin is present in cases of fetal anemia, in cases of hemolytic disease of the newborn, from 365 nanometers, tumataas siya at nagiging 450 nanometers yung maximum absorption peak. So how will you ano nang gagawin mo after nun? So yung absorbance derived at 450 nanometers is subtracted from the absorbance derived at 365 nanometer. So that represents okay yung OD450 o yung difference ng OD450 sa normal absorbance. So the bilirubin peaks again at 450. So take note here, the oxyhemoglobin peak at 410. So anong ibig sabihin niyan? Ano yung importance niyan? So if there are in cases, there are presence of blood, so blood streak yung specimen, so it may inhibit the testing for OD450 because there, if may blood streak, of course may presence na hemoglobin, that will interfere with the determination for bilirubin kasi yung maximum absorption peak ng hemoglobin is at 410. Okay, so masasama yung oxyhemoglobin sa determination ng bilirubin. So the difference between the OD450 and the normal absorbance is plotted at this graph. So this graph is what we call as the Liley graph. Okay, so dito siya pinaplot yung difference nung 450 sa 365 nanometer. So ano yung importance nung graph na to? So for example, yung difference nag-fall dito sa point na to. So it only means that the severity of fetal anemia is under zone 1. So zone 1 meaning that the fetus is non-affected or it is mildly affected fetus. So for example, dito naman sa zone 2, moderately affected yung fetus. So zone 3, ito na yung sobrang severe na ng fetal anemia. So severely affected. So for zone 1, again, mildly affected. Zone 2, moderately affected, moderate hemolysis. So the intervention here is that there is a careful monitoring. So for zone 3, again, severe hemolysis. So what is the resolution or for zone 3? So there is a need for you to intervene now with the uh, condition. So how will you intervene? By induction of labor na. Induction labor or yung forced delivery. So kung hindi naman possible yung forced delivery or induction of labor, you can also try to administer intrauterine exchange transfusion. So if you try to remember in blood banking, intrauterine exchange transfusions, main purpose is to eliminate the presence of bilirubin in the amniotic fluid or amniotic membrane. So that is also an option, okay, option intervention for severe fetal anemia. So aside from that is another condition associated with fetal distress, so again, neural tube defects or NTDs. So NTDs is a group of birth defects in which the opening in the spine or cranium remains from early neural development. So again, nasabi ko na to kanina that neural tube defects, there is a opening from the spinal canal, okay, even after development. So what it is considered as one of the most common birth defect in the United States. Most common birth defect in the United States. So generally, how will you detect or diagnose neural tube defects? So the screening for neural tube defects or conditions such as anencephaly and spina bifida it is usually performed by determinations of the maternal serum. So what are you trying to detect in the maternal serum? So you're trying to detect elevated levels of maternal serum alpha-fetoprotein or MSAFP. So again, you're trying to screen for the elevated levels of MSAFP. So saan napapasok dito yung amniocentesis? Okay, so here is a routine protocol for diagnosis of NTD. So the screening is made usually primarily by um, performing ultrasound examination. So it is the primary screening tool. And then secondary screening tool, yung maternal serum fetoprotein. So if there are an abnormality in the screening, so doon ka pa lang mag-undergo ng confirmatory tests or confirmatory procedures such as, ito na yon, yung amniocentesis. So what are you trying to detect in amniotic fluid? So the presence of elevated amniotic fluid alpha-fetoprotein as well as elevated levels of acetylcholinesterase. So again, the screening test for amniotic fluid is by measuring amniotic fluid AFP. So it is produced by the fetal yolk sac and then eventually by the fetal liver. So ano yung expected result natin for amniotic fluid AFP? So there's an increase again AFP, so greater than 2 multiples of median. So yon, neural tube defect, may indicate neural tube defect. So if you want to confirm the elevated result of AFP, you need to perform acetylcholinesterase, which is considered as the confirmatory for AF-AFP. So why is it considered as the confirmatory test for AF-AFP? So because it is more specific for neural tube disorders than AFP. Okay, so it is more specific for neural tube disorders. So take note that the presence of bloody specimen in amniotic fluid may cause and falsely increase acetylcholinesterase because if you try to remember acetylcholinesterase in clinical chemistry, it is present on neuromuscular junction as well as present in RBCs. Okay? So blood or RBCs contain acetylcholinesterase. So again, take note, bloody specimen may falsely elevate acetylcholinesterase. Next, we have tests for fetal lung maturity. So, again, as I said earlier, fetal distress, whether caused by hemolytic disease of the newborn or neural tube defects, may prompt the obstetrician to consider preterm delivery. Okay, so to ensure that there is a safe delivery, so you must assess the fetal lung maturity. So if you're wondering why is there a need for you to assess the fetal lung, so it is said that the last organ to be developed is the fetal lung. So kung develop na yung fetal lungs mo, yung fetal lung, so ibig sabihin develop na rin yung ibang organ. So pwede na siyang makasurvive in the outside world, in the environment. Okay, so yun yung main reason kung bakit ang ina-assess mo in order for you to assess kung mature na ba yung fetus is the fetal lung. So what are the tests under fetal lung maturity? So we have LS ratio, amniostat FLM, foam stability index or foam test, lamellar body count, OD650, and the MFPI or microviscosity fluorescence polarization assay. So we start with LS ratio or lecithin sphingomyelin ratio. So before that, uh, what what if hindi mo mineasure yung fetal lung maturity before mo i-consider yung preterm delivery? So si baby, if di pa siya mature yung lungs niya, pwede siyang mag-undergo or pwede siyang magkaroon ng respiratory distress syndrome. So respiratory distress syndrome is the most frequent complication of early delivery. So ano ba yung cause ng respiratory distress syndrome? So insufficiency of lung surfactant or immature pa yung lungs ni fetus. So again, kung immature pa yung lungs ni fetus, immature pa rin siguro yung ibang mga organs niya. Okay, so insufficiency of lung surfactant and structural immaturity. So again, lung surfactants or lung phospholipids are produced by type 2 pneumocytes. So type 2 pneumocytes, type 2 pneumocytes are situated in the alveoli. So sila yung nagproproduce ng lung surfactants. So again, lung surfactants include uh, phos- uh, lecithin, sphingomyelin, and phosphatidylglycerol. So the lung surfactants, yung tatlong yon, si phosphatidylglycerol, glycerol, lecithin, sphingomyelin, are organized into densely packed layered storage granules called lamellar bodies. So kapag na-mention ko mamaya na lamellar bodies, what I'm trying to refer to uh, what I'm trying to refer is if sinabi ko yung lamellar bodies, yung presence ng tatlong phospholipids natin, si lecithin, si sphingomyelin, and si phosphatidylglycerol. Okay. Okay, so again, si lecithin, sphingomyelin, si phosphatidylglycerol. So, huwag kakalimutan yan. So, what are the functions of lecithin, sphingomyelin, phosphatidylglycerol? Allows the alveoli to remain open throughout the normal cycle of inhalation and exhalation, keeps the alveoli from collapsing by decreasing surface tension. So now, dito na tayo pupunta kay LS ratio or the lecithin-sphingomyelin ratio. So, lecithin is considered as the primary lung surfactant. So, sphingomyelin produced at a concentrate after about 26 weeks gestation. Since lecithin is considered as the primary lung surfactant, so from that, mahulaan nyo na kung ano yung result dito. Dapat, normally, mas mataas dapat yung lecithin sa sphingomyelin. So, ang ratio niya is that it must be greater than 2. So, dapat again, mas mataas yung nasa numerator, which is lecithin, kaysa kay sphingomyelin. So, LS ratio indicates, greater than 2 LS ratio indicates mature lungs, ibig sabihin, safe for delivery. So, take note here, pwedeng magkaroon ng falsely elevated LS ratio, okay, kapag may contamination ng blood or meconium. Okay, so again, blood or meconium. Because blood and meconium, or blood, specifically the hemoglobin or hemoconium, contains lecithin and sphingomyelin. Okay, so take note, sa lahat ng mga test na mababanggit ko, lahat ng mga test na nagme-measure ng either lecithin and sphingomyelin, lahat ng mga test na yon affected by blood or meconium. So, how will you assess or determine lecithin and sphingomyelin? So, it is mainly assessed by quantitative measurement by means of thin layer chromatography. So, itong thin layer chromatography, tedious to, labor intensive. So, that's why itong measures for lecithin sphingomyelin ratio, it is now replaced with phosphatidylglycerol assay or lamellar body or lamellar density procedures. So, kasi ito, mas less tedious or mas less labor intensive. Okay, kasi ito, si lecithin sphingomyelin, ito yung considered as the gold standard. But, even though it is considered as the gold standard, so yung procedure for determination, labor intensive. Okay, so, pinalitan na siya ng phosphatidylglycerol assays as well as lamellar body density procedures. Next, we have phosphatidylglycerol determination or amniostat FLM. So again, phosphatidylglycerol is considered as one of the lung surfactants. So usually, PG is also quantitated by performing thin layer chromatography, same as with lecithin and sphingomyelin. But there is a rapid test for amniostat FLM. There is a rapid test for PG, which is known as the amniostat FLM. So it is an immunologic agglutination test. So it uses polyclonal anti-phosphatidylglycerol anti-sera specific for phosphatidylglycerol containing lamellar bodies. So again, lamellar bodies are the densely storage packed granules which contain the three lung surfactants, lecithin, sphingomyelin, and phosphatidylglycerol. So from that statement, ito kaya si phosphatidylglycerol, affected kaya ito by blood or meconium? Okay, so the answer is hindi. Okay, so phosphatidylglycerol amniostat FLM isn't affected by presence of blood and meconium. So again, ang mga analytes lang affected by the presence of blood and meconium or hemoglobin and meconium is yung mga test na nag-a-assess ng levels ng lecithin and sphingomyelin. So the results here are reported as negative, which means there is a pulmonary immaturity. Low positive or high positive indicates pulmonary maturity. So again, this test is not affected by blood or meconium. Next, we have the foam or shake test and foam stability index. So, si foam shake test or foam stability index are mechanical screening for determination of lung surfactant. So, mechanical screening, it doesn't use any chemical reagents or any procedures. So, ang gagawin mo lang dito sa both foam shake test and foam stability index is literally to shake it. Okay. So, foam or shake test, paano yung procedure nito? Amniotic fluid is mixed with 95% ethanol, shaken for 15 seconds. After which, you allow the specimen to sit undisturbed for 15 minutes. So 15 seconds na shake and then undisturbed for 15 minutes. So ano yung positive result dito for foam or shake test? So the normal result or the positive result here is there should be a presence of continuous line of bubbles. So ano ibig sabihin ng continuous line of bubbles here? So the persistence of the bubbles denotes sufficient amount of phospholipids. So, of may bubbles, ibig sabihin may sufficient amount of phospholipids. So, kung sufficient yung amount of phospholipids, it means that there is a pulmonary maturity. Next, we have foam stability index that is considered as a modified foam test. So basically, ang difference nito ni foam stability index with foam or shake test is that this is a semi-quantitative test. Okay, so semi-quantitative meaning may mga concentration or may dilution involved. Okay, so there is a dilution involved in foam stability index. So the normal result here is that there should be a greater than 47. It means na may persistence ng bubbles at greater than 47 or 0.47 na increment. Okay, so greater than equal to 47 may indicate fetal lung maturity. So again, both foam or shake test and foam stability index are affected by blood and meconium. So again, a reason because in foam or shake test and foam stability index, you're trying to detect the presence of phospholipids. So again, kung phospholipids, you're trying to assess the levels of phosphatidylglycerol, lecithin, and sphingomyelin. Okay, so again, lahat na may lecithin, sphingomyelin, affected yon by blood and meconium. Next, we have OD650 or the lamellar body density analysis. So kanina nabanggit ko for HDN OD450 for bilirubin, si OD650 naman for lamellar bodies. So again, if you're trying to recall, lamellar bodies are densely packed storage granules form of the phospholipids. So again, pag nabanggit si lamellar body, tatlong lung surfactants agad nyo nandyan. Sino yun? Si lecithin, sphingomyelin, at si phosphatidylglycerol. Okay, so again, pag you're trying to refer lamellar bodies, you're trying to refer the three phospholipid, lecithin, sphingomyelin, and phosphatidylglycerol. So it is examined by using a wavelength of 650 nanometers. So the presence of lamellar bodies increases the OD or the absorbance of amniotic fluid. So same lang siya ng process actually with OD450. I-measure absorbance at OD650 and then i-measure yung baseline absorbance natin again which is 365 nanometers. So ipagsusubtract lang yon and then yung difference dapat greater than 150 or 0.150. Okay? So absorbance of 0.150 indicates fetal lung maturity. So again, for OD650, it is affected by blood and meconium. So again, pag sinabi mong lamellar body, involved ang tatlong lung surfactants na yan. So again, may presence ng lecithin and sphingomyelin. That's why affected siya ng blood and meconium. Next, we have the microviscosity fluorescence polarization assay. So it is a most widely used test in evaluating FLM. So it is considered as the excellent screening tool for FLM. It correlates well with the gold standard, the lecithin and sphingomyelin ratio. So it is based on the principle that phospholipids decrease the microviscosity of amniotic fluid. So take note, again, for MFPA, you're trying to detect the presence of phospholipids. So kung phospholipids, you're trying to detect, again, the three lung surfactants, lecithin, sphingomyelin, and phosphatidylglycerol. So from that, alam nyo na. So it measures lecithin, sphingomyelin. So again, this test is affected by blood and meconium. So again, affected by blood, meconium, maternal urine, and visibly ecteric sample. Next, we have lamellar body count. So lamellar body count is based on the principle that lamellar bodies, so again, lamellar bodies, yung densely packed storage granules of the lung surfactants, similar siya sa size ng small platelets. So ranging from 1.7 to 7.3 femtoliters or 1 to 5 meters. So usually, ang lamellar body count or LBC, ginagawa siya sa platelet channel ng mga hematology analyzer. Okay, so usually, ginagamit siya or in-obtain yung result na yan by using the platelet channels of the automated hematology analyzer. So again, magkapareho ka sila ng sizes. Okay, so I have a question. Is lamellar body count affected by blood or meconium? So, ang sagot doon, yes. So again, when you speak of lamellar bodies, you're trying to detect the presence of three lung surfactants. So lecithin, sphingomyelin, phosphatidylglycerol, in which lecithin and sphingomyelin affected by blood or meconium. So again, it is affected by blood, meconium, mucus. Specimens are stored at refrigerator temperature. So lahat naman actually, lahat 'di ba ng tests for fetal lung maturity stored at refrigerator temperature. So now move on to the practice questions or review question. So, amniocentesis is performed on a 32-year-old female at 17th week gestation. So, the specimen is received in the laboratory and the clinician wants to confirm the specimen is amniotic fluid and not urine. Which test would be most helpful to differentiate these two fluids? So again, in here, the physician or the clinician wants to differentiate amniotic fluid and urine. So again, there are two tests in which you can determine or differentiate the amniotic fluid and urine. You can either perform chemical analysis or different tests. So in here, yung mga nasa choices, of course, chemical tests. So ano yung mga analytes na yon that you should consider? So again, you can differentiate amniotic fluid in urine by analysis of glucose, protein, urea, and creatinine. Okay, so again, glucose, protein, urea, and creatinine. So again, urea and creatinine, sila yung most reliable test. Si glucose, protein yung less reliable. Of course, si urea and creatinine, increased yan in amniotic, rather in maternal urine. Okay, increased ang urea at creatinine sa maternal urine. Tapos, usually positive naman ang glucose protein saan? Sa amniotic fluid. Next, which of the following assesses fetal lung, wait lang, may assesses ba? Wala lang. Okay, which of the following assesses fetal lung maturity in amniotic fluid? So again, for fetal lung maturity, tests that you need to consider if you're considering preterm delivery. Okay, so for fetal lung maturity, the answer here is letter B. So amniostat FLM or phosphatidylglycerol test or assay. So again, it is under fetal lung maturity test. For bilirubin, again, it is under tests under fetal distress in cases of hemolytic disease of the newborn. So AFP naman, tests under for tests for fetal distress din yan, together with acetylcholinesterase. So again, tests for fetal distress specifically in the diagnosis of NTDs. Okay, so again, neural tube disorder. Okay, so spina bifida as well as anencephaly, AFP and acetylcholinesterase. Next, which assay for fetal lung maturity is using amniotic fluid may be performed using the platelet channel of an automated hematology analyzer. So again, ang principle nito is that itong analyte na to, same daw siya ng size with the size ng platelets. Okay, size ng small platelets. So the assay for FLM done by platelet channel is lamellar body. Okay, so again, lamellar body count is done at platelet channel of an automated hematology analyzer. So again, lamellar body count is affected by blood and meconium. So which test for FLM or fetal lung maturity is least affected by contamination with hemoglobin and meconium? Okay, so again, if you're trying to remember, yung mga tests affected by blood or hemoglobin and meconium are tests that assess the levels of lecithin and sphingomyelin. Okay, so again, yung nag-iisang lung surfactant or phospholipid not affected by presence of blood and meconium is phosphatidyl glycerol. So sa mga tests na to, sa ABCD, sino dito yung test that measures phosphatidyl glycerol? So isa lang yon. So phosphatidyl glycerol detection or test by means of amniostat FLM. Okay, so again, amniostat FLM only measures phosphatidylglycerol, which is not affected by presence of hemoglobin and meconium. So all of the other choices, foam stability index, LS ratio, microviscosity, fluorescence polarization assay, affected by blood and meconium. So now we move on to the last other body fluid, serous fluid. For serous fluid, I will not be discussing all of the serous fluid, but I will be placing an emphasis on the differentiation of the transudative serous fluid and exudative serous fluid. Okay, so let's start first with the physiology of serous fluid. So there are three main closed cavities of the body. So we have the pleural cavity, pericardial cavity, and peritoneal cavity. So all of which stores visceral organs. So pleural cavity, under niyan, nandyan yung lungs, pericardial, nandyan yung heart. So peritoneal, yung mga organs under ng gastrointestinal tract. Okay, so all of these cavities are lined by membranes, two membranes such as the serous membrane. So yung dalawang membrane na yon is called as the parietal membrane and visceral membrane. So collectively, these two are known as serous membrane. So parietal membrane lines the cavity itself. So for example, here in the peritoneal cavity, ito yung ito yung parietal membrane mo. Okay. Okay, yun yung parietal membrane. Yung visceral membrane lines the organ itself. So, kung for example, ito yung stomach, ito yung visceral membrane. So, nasaan ngayon dyan yung serous fluid? So, the fluid is contained between the parietal and the visceral membrane. So, nandito. Okay, nandito yung serous fluid. So, how will you collect serous fluids? Okay, of the different body cavities. So, for pleural cavity, you need to perform fluorosynthesis for obtaining pleural fluid. For pericardial fluid, you need to perform pericardiosynthesis. For peritoneal fluid, you need to perform paracentesis. So in here, si peritoneal fluid, usually hindi na siya tinatawag na peritoneal fluid. So kino-consider na siya or tinatawag na siya ngayon as ascites. Okay, ascites or ascitic fluid. Okay? So, ano yung normal volume na pwede mag-collect for serous fluid greater than 100 ml? So, abundant naman yung volume ng serous fluids natin. So, it is usually collected in 3 tubes. So, usually for EDTA, cell count and differential, sterile heparinized tubes or sodium polyanethol sulfonate for microbiology and cytology, plain tubes are heparinized for chemistry tests. Okay, those tests those chemistry tests may be for pH. Okay, so again, take note for pH analysis, maintain anaerobically in ice. Okay, anaerobically in ice or in ice slurry transport. Next, we have transudate. So before we go to transudate, in cases of infection or inflammation, right, in cases of certain condition that may damage or involve the parietal or visceral membrane, pwedeng magkaroon ng increase in serous fluid. Okay, increase in serous fluid. So those condition is known or termed as effusion. So effusion is differentiated or effusion is categorized either as a transudative effusion or exudative infusion. So transudates or transudative effusion form usually because of a systematic or systemic disorder. So systemic disorder that may disrupt the balance in the regulation of fluid filtration and reabsorption. So ano yung mga conditions associated with transudates? So in cases of hypoproteinemia, or changes in hydrostatic pressure such as in congestive heart failure. Ano ba yung mga conditions associated with hypoproteinemia? So, pwedeng cirrhosis, pwedeng nephrotic syndrome. Okay, those conditions manifest hypoproteinemia. For exudates naman, exfusions naman siya that directly involve the membranes itself within the body cavity. So usually associated siya with infections, malignancy, inflammation. Okay? More of a pathologic yung cause ng exudates. Okay? May pwedeng infection, malignancy, inflammation, or hemorrhage. So ito na yung mga keyword nyo for you to classify if exudate siya or transudate. So kapag may infection, malignancy, inflammation, hemorrhage, of course, exudates. So here's a comparison of transudate and exudates. So in here, tingin tayo dito sa ilalim, the most reliable differentiation of transudates and exudates is usually obtained by determination of the fluid or serum or blood ratio for protein and LD ratio. Okay, so that's why ito yung in-emphasize ko. Okay, because the most reliable way to differentiate transudates and exudates is by means of fluid serum protein ratio or fluid serum LD ratio, both of which increase si exudate. Okay, si total protein ratio for exudate greater than 0.5, for LD ratio naman greater than 0.6. So pag mas mababa, yun yung transudate. Okay. But usually, itong fluid serum protein ratio as well as fluid serum LD ratio, applicable siya for pleural and pericardial transudates and exudates. But there is a more reliable way to differentiate uh, peritoneal or ascites, transudates, and exudates. Yun yung serum to ascites albumin gradient. So that is the most reliable way to differentiate ascite transudate or acidic transudate or acidic exudate. Okay, so saag ratio. So yung saag ratio dapat na result in order for you to consider if it is a transudate greater than 1.1. For exudate naman, less than 1.1. Okay, take note that for transudate greater than 1.1, yung saag ratio, exudate less than 1.1. Next, we now move on to chylous and pseudocylous effusion. So, why is it necessary for you to differentiate chylous and pseudocylous effusion? Because pareho sila ng appearance sa fluids, okay, sa serous fluid. So they may resemble or they may cause the serous fluids to become milky in appearance. Okay? May simulate milky appearance. So although they have the same appearance, magkaiba sila ng pathophysiology. So for chylous effusion, it is usually caused by thoracic duct leakage. For pseudochylous effusion, chronic inflammation. Okay? So, in here naman, ang pinaka-importanting dapat tandaan for you to differentiate chylous and pseudochylous effusion is these three. Okay, the presence of cholesterol crystals, triglyceride, and Sudan staining. So, cholesterol crystals, take note, the present sino? Si pseudochylous. Okay? Present yung cholesterol crystals kay pseudochylous. That's why, if you're trying to perform polarizing microscopy between chylous and pseudocylous effusion, saan nyo mag-manifest ang multi-cross formation. Of course, multi-cross formation will only manifest if may presence na cholesterol. So, sino yung may cholesterol? Pseudocylous effusion. So, ito si pseudocylous effusion yung mag-manifest ng multi-cross formation in polarizing microscopy. How about for triglyceride? So, sino dito yung mataas yung triglyceride? Take note yung kabaliktaran naman ng pseudocylous, si chylous naman. Si chylous may greater than 110 na triglycerides. Meanwhile, for pseudocylous, less than 50. So, in connection with triglycerides, magpa-positive sa Sudan 3 staining, which is considered as a stain for neutral fats or triglyceride. Magpa-positive dyan or strongly positive si chylous effusion because again, it is increased. So, chylous effusion has an increased triglyceride greater than 110 mg per deciliter. For pseudocylous, usually for Sudan 3, since less or mababa ang triglyceride, negative or weakly positive. Okay, so that would be all. So now we move on to the review questions or practice questions. So results from a cloudy yellow pleural fluid from a 56-year-old male are listed below. So the WBC count, 1,550 per UL microliter, which is predominantly neutrophils. Fluid to serum bilirubin, 0.8. Fluid to serum total protein ratio, 0.9. Fluid to serum LD, 0.7. So these results indicate the fluid is most likely. Okay, so how will you approach this type of question? Okay, so may dalawang way kung paano mo siya i-approach. Okay, so pwede mo tignan yung appearance muna nung specimen. Okay, kasi in here, Under sa choices, may transudate, exudate, chylous, and pseudochylous. So, dito, pwede mo na agad ma-eliminate si chylous and pseudochylous since the appearance of the pleural fluid or the serous fluid is what? Isn't milky. So again, nagmamanifest ang chylous and pseudochylous kapag may milky appearance. So cloudy and yellow. So pwede mo na agad tanggalin si chylous and pseudochylous. Okay. Next way, you can look at the WBC count. So WBC count increase ang 1,550 predominantly neutrophil. So as we all know, neutrophils is increased in cases of bacterial condition or inflammation. So again, if you're trying to recall, kapag nabanggit ang infection, malignancy, hemorrhage, saan lang yon? Exudative effusion, di ba? Exudative kanina. So from that, alam mo na agad yung tamang sagot kahit hindi mo alam itong values na to. Itong tatlong values na to. Kasi from that, alam mo na neutrophil again for infections or inflammation. So in here, ang tamang sagot, exudate. Okay, exudative effusion. So, again, recall lang natin, review lang natin yung tamang mga values for differentiation ng transudate and exudate. So, for exudate, dapat, for fluid serum total protein, dapat greater than 0.5. For fluid to serum naman, LD ratio, greater than 0.6. How about for chylous? Kailan mo i-consider for chylous and pseudochylous? So again, if may nabanggit sa given na milky appearance as well as dito sa value may nabanggit naman na triglyceride ratio or level of triglyceride or presence of cholesterol. Okay, so again, for chylous effusion, greater than 110 mg per deciliter triglyceride, negative for cholesterol. Okay, so how about for pseudochylous? Pseudochylous less than 50 triglyceride, positive for cholesterol. That's why for pseudochylous, again, positive for Maltese cross in polarizing microscopy. Next, results from a milky peritoneal fluid demonstrate an elevated triglyceride content and the presence of chylomicrons. These results indicate the fluid is most likely. So again, at the first look, alam mo na agad kung ano yung tamang sagot. Okay, so again, milky appearance. So kapag milky appearance, you must consider chylous or pseudochylous lang. Okay, so nabanggit dito na elevated daw yung triglyceride content. So pag elevated ang triglyceride content greater than 110, so the answer is chylous effusion. Okay, so again, chylous effusion is usually caused by thoracic duct leakage. So greater than 110, triglyceride negative for cholesterol, positive for Sudan staining. Pseudochylous less than 50 mg per deciliter triglyceride, positive for cholesterol, as well as presence of Maltese cross in polarizing microscopy. Next, we have acetic fluid or ascites exudate is most reliably differentiated from acetic fluid transudate by means of. So again, usually the differentiation of exudate and transudate is made by performing fluid to serum, LD, and protein ratio. But for ascites or acetic fluid, the most reliable differentiation is made by means of measuring serum ascites albumin gradient, in which acetic fluid exudate, okay, for exudate dapat less than 1.1. Okay, for transudate, for Saag ratio, again, greater than 1.1. Ay, 1.1. Ano ba yan? Nagkakalat. Okay, 1.1. Okay. Okay, so that would be all. So, good luck in your examination. So, MLS ACP. Yes.